We're here at HIMSS 2017. We're talking with Ben Weber. He's the managing director at Pivot Point Consulting, a Vaco company. Welcome, Ben.
Hey, thank you, John. It's great to be here.
Great. So I know that you guys just published a health IT market report, and you've been doing this for a long time, and looking at the healthcare IT career marketplace. So, what was the most surprising thing you found in this market report?
Sure, I appreciate it. This year marks our trend edition. So we've been doing this report for roughly 5 years, and we pulled data for the last 3 years to look at the market from an analytical perspective, to look at trends from a healthcare IT perspective. And there's a number of trends in there that are surprising, but I think one of the most surprising is just the emphasis our consultant population places on medical, dental, vision benefits, as well as the ability to work from home, as well as the location of the health system. All three of these are pretty large trends that we've seen increase over the last 3 years, to the point that from a medical, dental, vision perspective, 48% of our consultants have determined that that's an extremely important component of their decision-making process. 38% for the ability to work from home, and roughly 25% the location of the health system. So these are increases over the last 3 years, so they're becoming more and more selective, and they're also recognizing the value they bring to the marketplace as subject matter experts and taking a little bit more for their time, for example, which I think is important. I think providers and consulting firms need to also continue to understand that and be able to speak to that for them.
That's interesting. When I checked it out and read through the report, the thing that hit me most was that I think it was 80% of people surveyed were satisfied or extremely satisfied with their work. So the health IT workforce is very happy with it, which makes sense because they're relatively well paid and they're doing something that has an extremely important mission. So it makes a lot of sense.
That's exactly right. And we had roughly 836 respondents, and the majority of those are seasoned or senior subject matter experts from an EHR implementation and support perspective. So they are sought after. The demand continues to be high, and the supply at that level, at that expertise level, continues to be lower. So yes, they are predominantly satisfied and optimistic as well.
No, it's great, and I think it's interesting that you've been doing it for 5 years, and so this is a trends report. So what are the trends you're seeing that you've seen across all these reports?
Yeah, again, optimism is up over the last 3 years. I think a lot of that has to do with the macroeconomic factors of the United States as a whole, and then the sheer amount of innovation that's going into the healthcare IT marketplace right now. There is a lot of opportunity out there. So individuals who are experts in their field from an implementation and support perspective of an EHR continue to see tremendous opportunity and growth, even through health system provider consolidation. So, that's one of the key trends for us. And again, back to some of the trends that I mentioned in terms of career progression and career moves, in terms of what consultants are after. There's a number of key trends for us.
Interesting. So we've worked together on this at Healthcare IT Central. We help promote it and get more surveys. And the thing that most of our people want to see is something a little bit banal, but what's the most high-paying health IT job?
The majority of our respondents are focused on Epic implementation works, roughly 80%. So for us, we see that Epic project managers and Willow Beacon pharmacists continue to be the most sought after and continue to have the least amount of supply in the marketplace, which are driving up those rates. So we're seeing, the most well-paid individuals are those Willow Beacon pharmacists. So that pharmacy degree, whether master's or doctor or even bachelor's, is tremendously important to an implementation. And then those Epic project managers who have been through multiple implementations, again, tremendously important. So they're placing a high value on those consultants as we speak.
That's great. It reminds me of the HR manager who had a doctor complain to him, "Why are you having me do this? Why don't you have the Epic consultant do it?" And they're like, "Oh no, you're cheap compared to the Epic consultant." So it was pretty funny. So where can people find the rest of the survey and all the other data and insights into what's happening in the healthcare IT job market?
Yeah, thank you, John. So you can reach out to any number of our employees at Pivot Point Consulting, a Vaco company. They'll be able to provide both soft and hard copies to you, or go to pivotpointconsulting.com and there'll be a link to access the survey there.
Excellent, and we'll be sure to send it out on Healthcare IT Central to our community and the healthcare scene community as a whole. Thanks a lot. We've been here with Ben Weber, Managing Director of Pivot Point Consulting, a Vaco company. Check out more great content at healthcarescene.com.